Every child deserves to smile confidently, but in Jagna Bohol, that simple joy is often taken away by something as small yet as painful as a toothache.
Can you imagine? Nearly 97% of 4-year-olds here already have cavities, 6 per child on average. That's not just a dental issue, it's a health crisis.
Most residents depend on small, under-resourced clinics for primary care, and when they need advanced treatment, they often have to travel hours to the nearest city, which can be expensive and time-consuming. And because of that, one of the biggest groups affected are children. Many of them miss out on basic dental care, leading to widespread cavities and untreated dental problems.
That's why addressing oral health among school children in Jakarta isn't just about fixing teeth, it's about improving long-term community health.
Right now, Phyllis Health already runs several great programs to help reduce dental problems among children in Jagna. These include school-based clinics, regular checkups, and community education sessions. But despite the success of these efforts, the clinic still faces major operational challenges behind the scenes, especially when it comes to managing data.
Everything from patient records, appointment logs to consent forms is still handled on paper. That means every visit, every treatment, and every follow up all have to be written down and stored manually. As you can imagine, this makes it really hard to keep track of each child's treatment history over time.
To help with that, a Google Forms system was introduced. It was a great step forward, but there is a catch. The clinic's internet connection is relatively unstable, so the system doesn't always work reliably. Plus, staff have to enter the same data multiple times, and there's no easy way to see summarized or visualized results.
Scheduling is another big challenge. Appointments and follow ups are coordinated manually through the teachers and parents, often just by sending text messages. There's no central schedule or notification system, which means things can get confusing, and sometimes kids who need follow ups fall through the cracks.
Finally, there is no standard method to track follow-up care, identify high-risk students, or measure the long-term impact of the dental program. So even though Phyllis Health is doing incredible work, these inefficiencies make it difficult to see the full picture, to really know how much progress is being made or how to scale these efforts to other schools.
In short, the clinic's heart is in the right place, but the tools they're using just haven't caught up yet.
With the current situation in mind, our goal was clear: to make dental data management simpler, more reliable, and more engaging for both students and staff.
So, what does that actually mean for the design? First, it needs to have a concise and intuitive data entry process. Dentists shouldn't have to dig through forms or type endlessly.
Second, the kiosk must work without relying on school Wi Fi.
Third, students should be able to check their dental health status anytime at school. By giving them direct access, we help build awareness and encourage early habits of self-care.
And lastly, the kiosk should allow dentists to view summaries, trends, and follow up lists instantly to make the process a little easier.
With those in mind, our team would like to present our solution prototype. It contains two main parts, hardware and software. Before implementation, each child also gets an ID number printed on a fun sticker, something personal and kid-friendly.
After 10,000 hours of thinking and designing, and after several prototypes, meet Tuti, a hardware prototype, we wanted something that didn't look intimidating because let's be real, who likes going to the dentist?
Oh no, not me! And definitely not the kids. Imagine them walking into the clinic and seeing a big metal machine. Scary, right?
Right. So instead, we created Tuti, a fun, T-shaped kiosk that's friendly, inviting, and just a little bit adorable. The idea is simple. If it looks like a friend, kids will want to interact with it. Suddenly, check-ins feel less like a medical task and more like a game.
Now, aside from being cute, 2D is also pretty smart. It's built with an adjustable stand, which means it can switch between two modes. In its tall mode, it's perfect for dentists or tech staff to run maintenance, updates, or check data without having to crouch down.
And then, with just a quick adjustment, Tuti lowers down to kids mode. That's when it becomes a child-friendly kiosk, the perfect height for students to check in their own or view their dental health progress.
It's kind of like 2D grows and shrinks depending on who's using it. Pretty cool, right?
Yeah, Tuti is flexible and friendly. Two things we wish more dental tools were.
In our current prototype, we're using an iPad as the display. That's just for testing. In the final version, Tutti will have a much larger screen, so kids can clearly see everything from their dental records to fun educational visuals about brushing.
Because if you're 4 years old, squinting at tiny icons isn't fun. A bright, big screen turns learning about teeth into something visual and engaging.
And here's where the magic happens behind the scenes. Tutti can work offline, which is a big deal in places like Jagna where Wi Fi isn't always reliable. It stores all data locally, and once the internet's back, it automatically syncs everything with the clinic system. No more lost records, no more guesswork, just smooth, connected care.
Which means the dentist can focus on treating kids, not on fixing tech problems.
Exactly. Tutti's here to help, not to get in the way.
A friendly tooth might just be the secret to healthier smiles in Jaffna.
Alright, so for the software, the Smart Dental Kiosk reimagines school dental check-ins by making them faster, smarter, and more enjoyable. Instead of relying on time-consuming manual processes, the system uses an automated priority-based queue that quickly identifies each student's dental needs. Those with urgent concerns are seen first, ensuring timely care and smoother workflow for the dental staff. Its bright and interactive interface creates a welcoming experience that helps students feel at ease while giving dental professionals a clear, real-time overview of every case. In essence, this Smart Dental Kiosk transforms routine school dental visits into an efficient, organized, and engaging experience for both students and staff. This section features a video tutorial demonstrating how our Smart Dental Kiosk application works. Each student is assigned a unique 5-digit secret code which they can use to securely access their personal dental records. The system also allows users to select their preferred language, ensuring a comfortable and user-friendly experience for everyone. Once logged in, the kiosk automatically generates a clinical priority assessment report using an evidence-based triage system to identify students who need urgent dental care. The interface also displays the date of the last visit and recommendations for the next dental appointment. The system is guided by American Dental Association standards recognized as the gold standard for general dentistry to ensure proper emergency and basic care protocols. In addition, it follows American Academy of Pediatric Dentistry guidelines, which is the leading authority in children's oral health for accurate pediatric cavity risk assessment. This integration combines trusted adult emergency standards with specialized pediatric expertise, resulting in evidence-based school dental triage system that is both clinically sound and child-centered. Furthermore, students can access their visit history and explore Smile Tips, which is a section featuring fun and educational dental care content. Overall, this approach makes the process efficient, engaging, and informative, turning routine dental check-ins into a positive learning experience for children. This section demonstrates the backend system designed for the dental staff. Here, staff members can log in securely using a password that is known only to them. Once logged in, they can register a new student during their first visit by entering details such as age, dental concerns, and other basic information. Over time, this data can be updated, reviewed, or corrected as needed. Errors can easily be edited or deleted, ensuring accurate records. This system greatly simplifies the management process for staff, helping them maintain organized and up-to-date information, which might be difficult with Google Forms. Additionally, the backend is also available in 3 languages, allowing staff to work comfortably in their preferred language. Now let's talk about what makes Tutti such a game changer. First off, it's all about inclusivity. Whether a student speaks English, Filipino, or Bisaya, the kiosk makes sure everyone feels welcome and understood from the very start. No confusion, no awkward moments, just a smooth, friendly check-in. Now here's where it gets really smart. Instead of sticking to the old first come first served system, our evidence-based triage system steps in to do the thinking. It instantly checks each child's dental needs and bumps up those who need urgent care, so the ones in pain get help first and everyone's time is used more efficiently. For the dental team, the secure dashboard is a total time saver. It handles everything from registration to record keeping, so staff can skip the piles of paperwork and focus on what really matters, which is taking care of the kids. And for the students, the colorful friendly interface makes the whole experience feel approachable.
In conclusions, we have designed this digital kiosk MS addressing the core issues of the limited dental care access and efficient Google Phone system. By centralized data, working offline, and letting students check health status anytime, the kiosk streamlines logistical hurdles. Dentists can then quickly summarize to prioritize at-risk cases, while stable access means no more disrupt care due to bad internet issues. This can directly bridge resource gaps, ensuring all the students there, regardless of their locations or access to other tools, can also get a fairer and consistent dental health support.